Guys, welcome back to Medical Coding with Blue. Today's episode is all about what are the best specialties for new medical coders to work in. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. Sometimes when people are brand new to medical coding, they have an idea of where they want to work. Some people will write to me and say, Blue, I like to code for psych. I want to work in psych. Or I would like to do risk adjustment coding. So here's the thing. When it comes to having an idea, it's great, right? It's great to have an idea. But if you haven't done coding yet, we need to kind of look at it from a different point of view, because sometimes you might get stuck and you don't get to develop as quickly, and the depth of your knowledge kind of stays at a standstill, okay? Especially in the first year. First year is going to be the most unsettling, because this is where you're going to be learning things a lot, and this is constant and it's every day. You're going to feel unsure of yourself. There is no such thing as an easy specialty or easy coding. And for those of you who say, well, what about risk adjustment coding, Blue? That's just diagnosis coding. Yes, but the thing with risk adjustment coding, even though it's just diagnosis coding, you do have to understand pathophysiology. So I talked about this a couple weeks ago about why we have to learn pathophysiology. And we have to learn pathophysiology because that is the study of disease. This is where we start learning about symptoms of a disease and what goes with what. Because as we know, when there are symptoms and there's a definitive diagnosis, we're going to pick up the definitive diagnosis and not the symptoms. And the only time that you're reporting anything as a result of is if you're doing like sequela. So sometimes there might be like pain related to a trauma, and then we would code that with sequela if there's a causal relationship identified in the documentation. But that's another episode for another time. But the point about it is that when you try to work in risk adjustment, you're only developing your diagnosis skills. And a lot of people will say, well, that's great for me because I really didn't like CPT and I really don't understand evaluation and management. Evaluation and management is not as hard as people try to make it out to be, okay? It's actually very easy to grasp once you start getting it. But until then, if you start believing everybody else and oh, how scary and how hard it is, then you will always struggle with it. But I'm just saying, the thing with risk adjustment, getting back to that, is that you are only developing in your diagnosis code selections. A lot of times, employers will not count risk adjustment work as experience. I know this because when I do research for the show, I always look at the job listings all over, from California to Florida to Texas to Michigan to New York. I look everywhere. And when I'm looking at these job listings and they say if your only experience has been working in risk adjustment coding, this does not count as experience. I don't want people to waste critical minutes when they're working, okay? Not that risk adjustment coding is not important. It is important because it is for data collection and it helps with a lot of planning and forecasting and things like that. So while that's good, it kind of stunts your growth as a coder. So one of the best places to start off when you are starting off applying for jobs would be to apply for like the emergency department. Now with the emergency department, the best thing about the emergency department is you will see everything. And there is no getting bored with the emergency department, because you will see traumas, right? You'll see lots of broken bones when you code there. You will also see heart attacks, strokes, mother baby. You'll see a lot of those things when you're working in the ER. And sometimes you'll see just regular respiratory issues. Sometimes it's a cold. Sometimes it's a simple laceration. There's lots of things that you can get exposed to coding wise when you are working in the ER. So this will help you to kind of get a sample of the different specialties when you're working and you're thinking, okay, well, I would really like to kind of develop my skill, working in orthopedics or working in cardio. This is a great place to kind of get that exposure without having to commit to one single specialty. And especially when you're brand new, the best thing that you can do is meet the challenges as soon as you can. Because the more that you try to put it off, the more you say, well, I want something that's entry level. I want something that's easy. What is an easy specialty? I get that a lot too. And I ignore those questions because technically there is no easy specialty. There are redundant specialties. So there's a difference between easy thinking, okay, yeah, it's the same thing, coding the same thing over and over again, versus like, oh, this doesn't take much brain power, okay? But when you meet the challenges of coding for something that you think is maybe a little bit out of your league, and you meet that, that's going to build your confidence. The most important thing we can do for ourselves within the first year is to build that confidence and build it in a way that is going to prepare us for the future. Because as I said, you work some time in the ER, you get exposure to all kinds of procedure coding as well. It's not just some places they don't have the coders code for the procedures and the E&M. They have the providers do it, which makes me nervous. But it just depends. But if you are working in a good ER that has you code for everything, then you're going to get that well-rounded exposure. There's a lot of preparation, that is good for coders when you work in the ER. So again, you can get a good sampling there of all the different specialties. And a lot of people will ask, well, what are some resources that you can recommend for studying in the certain specialties like orthopedics and things like that? The best thing you could do is get your coding manuals and read those chapters. Read the chapter specific guidelines for the specialty that you're struggling with or that you want to learn more about. So if you're looking at the orthopedics, you're looking at the M-codes chapter, and you're looking at the injuries as well and the external causes. So you're looking at all of those and you're reading the coding guidelines related to those. If it's cardio, same thing. You look at the cardio guidelines in the guidelines in ICD-10-CM. And then of course you look at that chapter in CPT as well. And so that's how you start to kind of develop your skill that way. There is no magical book. There is no magical program that will prepare you better than you actually taking the time to get with the book and look at it yourself. And working through your workbooks, because hopefully you still kept your workbooks from school, and you going back over those workbooks and covering up the answers and not using multiple choice, that's also going to help you to develop. And so you can kind of get that built-in training while you're working in, for example, the ER, because that's going to teach you not to be afraid of anything. I am not afraid of any specialty. I have done just about every specialty there is, except for interventional radiology. I just never had the opportunity to do that. So that's the thing that you guys have to understand. I have coded for everything, and you need to be the same way too, because if you allow yourself to be made small and to, oh, I only want to do risk adjustment because it's not so hard, I heard. No. You're only going to hold yourself back from growth, okay? And again, this is a time that you want to be building that skill and building it well. And a lot of people will get stuck in this time in the first year of, oh, well, I'm working at a private doctor's office. If you're working at a private doctor's office as a new medical coder, you're going to be pulled to do a lot of other positions other than coding, because the budget is a lot smaller when you're working for a private doctor's office. They're going to have an all hands on deck approach to things. So if you are a coder and somebody called in the front desk, you're going to go help at the front desk. And I don't think that that's right, because you got hired on as a coder or a biller for whatever, if you choose that path too. And they're going to work you, okay? And they won't pay you like if you were working for a hospital, okay? So that's something that you need to think about when you're applying. And getting your experience and getting that right exposure to the right people is also going to help you. So sometimes if you're working in a small doctor's office, it's going to be a very small group, and 9 times out of 10, the office manager is going to be the spouse of the provider, and 9 times out of 10, they are not certified. They've never been to coding school. They've never gotten a degree in health information. So that also becomes a problem, especially if you are certified and they are not. So that's just something that you guys have to kind of think about. Don't set yourself up for failure by putting yourself in that kind of situation. You are in control, believe it or not, as new coders, to decide where you want to go. So go and work at the emergency department, work at urgent care, which is much like the emergency department, but you're going to see a lot of minor things. You're not going to see like heart attacks and strokes and things like that, like you would in the ER. With the urgent care, it's like earaches and, some broken bones, some sprains and that kind of thing. Simple things that can be taken care of in the urgent care department, which is fantastic for you because, again, it's still getting you exposure and you're still getting that good practice, and you get to sample all of these different specialties, which is a lot of fun because it doesn't become redundant and the same thing. The other place that you could work, obviously, would be for family practice or primary care, depending what they want to call it. But somebody who works family practice, primary care, they're going to see a lot of different things as well. It's sort of like the urgent care center, but you're seeing, in addition to like simple things, simple sprains, simple lacerations, that kind of thing at the primary care office, depending on how fast they see their patients. You're going to see a lot of well woman, well baby visits and that kind of thing. So there's also that kind of coding too. So it makes you more well-rounded, and somebody that understands a variety of specialties is going to be deemed stronger because you're not just focused on one thing. You have versatility wherever you go, okay? So I would strongly recommend applying for family practice or primary care, urgent care, or the emergency department, all right? Now, some of the specialties that can get you wide exposure as well would be orthopedics and podiatry. Now, when you're working in orthopedics and podiatry, you may think, well, Blue, that's just bones. Your bones have a lot to do with the healing of your bones, has a lot to do with the vascular system. So when patients come in and they're being treated for their bone issues, whether it is an injury or an organic condition, the provider is also having to consider, like, if they're a diabetic or if they have hypertension. This goes into their decision-making process a lot of times when they are having to decide for surgery or decide on a certain treatment, because there's not all these treatments you can do for everybody. You can't give somebody a shot of a steroid if they have diabetes, because then you kind of have to look at, benefit and everything, because if you give somebody steroids, it could spike their blood sugar, right? That's one of the side effects. So that's one of the things that they would have to consider. Well, again, you having an understanding of pathophysiology and you knowing this, that's going to help you to know, okay, I have to, code this, or, if the provider is addressing this and they're having to use this for their medical decision making, that's giving you that exposure because it's not just one thing. And again, that goes for cardio as well, because that's the vascular system. If they're a smoker, that also affects the heart. And then if they have high cholesterol. So there's all of these things, these additional things that these patients could be coming in with that could affect their care. And it is the developed coder that is going to understand that and say, okay, well, this is a great way to build my skill. And that's the way you're going to be able to do that. So that would be what I would recommend. Pulmonary is another really great specialty. Rheumatology is another great specialty. And sometimes when you apply at a hospital, because there are outpatient clinics in a hospital, so even if you have a CPC or a CPCA or a CCSP, you can certainly apply for hospital outpatient clinics. And, usually they'll have an opening for a new outpatient coder, and if you apply, and then they're going to put you wherever they need you. Now, if they hire you and they say, okay, well, where would you like to go? You need to be very accommodating, okay? Because the more accommodating you are to them, the more they are going to want you. Like, okay, this person is ready to learn. Not, oh, well, if we could get me like the easiest one or the entry level. No. That credential that you have says that you are competent in all of these specialties. So that's what you need to remember when you're out there. And again, don't ask, what resources do you recommend? Because the guidelines are right there. And I know a lot of you neglect those guidelines because you still want to sit here and look around like, I don't understand. but all of the answers are literally right there in the guidelines. That's why I make a push every October to do the coding guidelines challenge. This year was the very first year that I've done it, and the response was not great. I was extremely disappointed about that, but that's my own thing. But I'm just telling you guys that to be a strong coder, you're going to know those guidelines, not memorize them, but have that in your mind already and know where to find those. And if you're studying, that's going to be one of the things you incorporate into your study, that chapter, that specific chapter, or chapters that you know that you're struggling with. Injury chapter or the external cause chapter, that kind of thing. The Z codes chapter. Z codes chapter is really long in the ICD-10-CM coding guidelines. So that's something that you really need to look at, because sometimes if a patient's presenting for an encounter and there's a Z code and you don't pick up that Z code because you don't know it exists, well, let's just say that things can get denied because of that. And you don't want that. Every one of you has the potential to do really well. And the best way you can prepare yourself is going through those guidelines, going back through your workbooks, covering up the answers, looking them up on your own without multiple choice. Blue, I don't have that. You go to the public library then. That is why we have public libraries. And a lot of public libraries are having to offer other things now, like a lot of audiovisual things. I saw this thing on Instagram the other day about how there's a library that it has a recording studio in it, and then it's got all kinds of things. And I was like, wow, that is really neat, you know. And then they have like where you can do like podcasts and stuff like that. I was like, wow, just to get people to come to the library, because they don't think about that. Everything's online, right? But actually spending time with books and being able to check out books. And your library may have an online catalog as well, that you're able to check out books online, and you can use like your tablet or whatever. So that's just another option, but that is something that you can use to help you prepare yourself. And like I said, if you're covering up the answers and you're using a book that is a couple of years old, that's okay. Now, except for evaluation and management. Now, if you're asking me where and how you can learn more about evaluation and management, then I feel like I have failed you. I've said this already. I know I mentioned this in another video, but I feel like I have failed you because of the simple fact that when I tell you guys to Google evaluation and management, whatever, or even going through my videos where I talk about evaluation and management and the books that I recommend, and all the books that I do recommend are in the description box below, and you're still not following it, tell me, please, guys, how do I need to communicate this with you? Please tell me, because I want my message to be heard. I don't want to have to sit here and answer the same thing over and over again. How can I say it in a way that it's going to click, right? How can I say that? And evaluation and management. Now, again, I talk about the workbooks and that you could use a couple year old, workbooks. But when it comes to evaluation and management, like the max you can go back is maybe 1 year, because evaluation and management did go through a facelift a couple of years ago. And so like in 2022, it's really started to have a lot of changes and stuff. So there's a lot of, older books than that are just not up to date. So if you're going to get an older workbook for evaluation and management, the oldest you need to go is 2024. The one that I recommend is in the description box below, and it's always going to be with Optum. So that's what I would recommend that you do. I do have the study syllabus specifically for evaluation and management, and it breaks down the book from Optum. You would have to purchase the book from Optum, but the study syllabus that I provide, if you order it from me, is like a breakdown of like the chapters and what you need to do, and supplemental resources for learning evaluation and management that I don't share anywhere. So that's the thing that I have to offer up when it comes to that. And no, it's not working the book from cover to cover. I did move it around so that you're able to build that skill, when I designed that evaluation and management study syllabus. So this is the one thing that's out there that you got to know. So with that said, those are the ones that I recommend. Working at the emergency department, working for primary care or urgent care. Some of the specialties like orthopedics and podiatry are really great for multiple specialty exposure, because it's not just the bones. There's lots of other detail about like injury things that you're going to learn, which is going to make you a strong coder, because then you're going to develop your research skill, because some things you do have to look up, you know, some of the things like, you know, injuries and things like that. And sometimes if a person is bitten by an animal, you need to find out what kind of animal it is, right? And because there's some bitten by, you know, whatever, and then they have the specific like hoof stock and things like that. So yeah, so it gets very specific, and those are things that you're going to have to do when you're working in that kind of specialty. So that would be what I would recommend. Do not sell yourself short. You do not have to get into entry level, because every job you're going to get as a new medical coder is going to be entry level. Every single job. Okay, even though, yeah, we want 3 to 5 years experience. They always want 3 to 5 years of experience. But you need to get out there and take those entry level blinders off, because you're a coder now. You're a coder like everybody else. The only difference is other people have years of experience on you, but it doesn't mean that you're not bringing in valuable gifts, okay? Your valuable gifts can come from your previous experience, or it can come from your ability to be very detail oriented, to work autonomously, to do your research. The list goes on and on. We need to start looking at, hey, we are actually bringing something to this field, and not that we are at the mercy of nobody wants to hire. They do want to hire. They just want to be able to hire competent people. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you next time. Bye.